How you doing, guys? So this is Dr. Sai at Specific Chiropractic. In this video, we're going to talk about coccyx pain and also snapping hip syndrome. Okay, so clue us into the viewers. How long have you been having that snapping hip syndrome?
The pain in my hip I've had pretty much my whole life. It snaps no matter.
These viewers just heard right there. There's that snapping hip right there. And also about the coccyx pain. How long
A couple years, after a couple motorcycle accidents, I think that pain has risen more and more.
Okay. So what do you have the most trouble doing when you have that coccyx pain?
Sitting, driving, anything that has to do with sitting.
I hear that. How long you can sit for?
Probably anywhere from 30 to an hour, and then it really bothers me to a point where I have to kind of stand up for quite a while.
Gotcha. When I hear about a case of coccyx region pain, all right, I want to take a closer look, see what's going on over here. The coccyx is right over here. And I see it actually, it's in proper alignment. What I do see, a different issue is when I take a look at these sacral segments, see this over here? There's a large space over here in addition to this second sacral segment over here, it's knocked backwards. There's 5 segments over here, and number 2 is misaligned over here. So when we're born, your sacrum is actually in 5 pieces, and it's supposed to merge into one bone, right? But if there's trauma during your childhood, it can knock and irritate something out of alignment. And in addition to, since it never properly fused, and in addition to all those motorcycle activities you've been doing, aggravated and knocked this fella out of alignment. So as we see with your second sacral segment over here, it's connected to your right hip joint and the left hip joint. So if this fella, if it misaligns, okay, in either direction, you can possibly knock this fella out of proper alignment. So therefore, when you try to raise that hip, clunk, clunk, clunk.
Exactly. A lot of aggravation.
Exactly. So snapping hip syndrome, typically what I'm going to look for is either it's going to be this hip itself or this fellow over here. But I have a hunch we could probably knock out 2 birds with 1 stone with this fellow alone. All right. The first thing we're going to do is we're going to do visualization and inspection. I want to see, is there any swelling in this area? And there is some swelling and puffiness on here as well. Okay. And we also trace things around as well. See, it's all swollen and puffy here. Tender right here?
Mm-hmm.
Yeah, I'm just barely touching this thing and it's already kind of uncomfortable there. Right?
Sure.
So we see a reading at this level right here. See, when we scan all the way down here to the coccyx, there's nothing. Okay, it's very, very slight, but not really, it's just a heat pattern, but not a reading at all. So the coccyx itself is fine, but this right here is 2S level, that's in trouble. Feel that difference here? I can move your right hip somewhat. Left hip is completely locked up.
Right.
How's that feel right there?
Yeah. Very tight.
See, it's locking up there. See, it's moving too much on this side, locking up that side. Yeah. Okay, now we're going to test the coccyx itself. How's that right there? Not bad, huh?
No.
See, because if this was a true coccyx pain over here, just lightly touching over here, he'd be jumping off of this chair right now, but he's not. So there's a lot of that false impression that it's a coccyx pain, but it's actually a sacral pain. So the problem's right here.
Yeah.
Okay, let's get to work. Okay, out the belly. There we go. Perfect. Right there. There we go. Okay, I'm gonna come back right over here. Okay, go ahead. Give it a.
It's a lot better. A lot better.
Why don't you sit down and see how it feels?
Doesn't hurt. That's good. I'm very happy about that.
All right, well that's what it's all about. Okay, you can stand right there, okay? So here's our protocol right now. I want you to just ice that down, 20 minutes, okay? 3 times a day, let it calm down, and I'll see you next appointment.
Thank you, Doc.
Oh, no problem, you're welcome.